there's that hormonal shift and it happens at a certain age, and we can more or less identify some of the more common symptoms. What would the symptoms for men like that they should be aware of at the early stages?
A bit information about menopause and especially andropause, how it relates to men.
Right. Okay, good. So I will go straight right in. So let's talk about andropause because I am an advocate of menopause and for the ladies. But when we touched base the last time, you said that men in general just do not like talking about it or maybe a bit apprehensive about being so open. But it is a serious issue, and there are men who also has difficulty coping with those changes. So, what can you share with us about this?
So, as we all know, like menopause is something very well known, common among females and even males. Okay, at one point that maybe their spouses will go through this phase of menopause. But how about andropause, which also sort of like creates a stop clock or a reduced clock in terms of male health and vitality. So, I will look into andropause. I think one of the biggest concerns would be for men is the drop of their vitality, especially in terms of hormones. We're looking at the level of androgenic hormones, which not what is testosterone, followed by androgens like DHEA, DHT, and etc. And they start to feel fatigued, tired. They have certain concerns about loss of muscle, sexual concerns. There's the start of ED. And today, one might think that this only happens at a very late age, maybe after late 50s, 60s, going on 70. But surprisingly, it's already starting even at the early 40s for some men.
Yeah. I mean,
This is a bit of a concern, Uda.
correct. And I think we both are seeing that trend where even for menopause, women think that, oh, this is a later or old people's disease. But the reality is because of the food we eat, the pollution, the stress levels, both men and women are experiencing all this a lot earlier. We have to agree on that, right?
Yes, definitely. And this is something that it is serious because we are uh, men are being affected at their prime age. So we've been even in their early 40s, and they are only having symptoms of this. So such symptoms are going to affect their reproductive health. It's going to affect how they work, how they operate, how they think, their focus. All of that affected when the drop of such hormones in them.
Yeah, definitely. So while we know biologically for women, there's that hormonal shift and it happens at a certain age, and we can more or less identify some of the more common symptoms. What would the symptoms for men like that they should be aware of at the early stages?
So usually for men, when the level of hormones start to plummet, especially testosterone, the first thing you start to feel is lack of energy, fatigue, tiredness, suffocation. And then they feel that they become a bit apprehensive in terms of going to a workout, and because they fatigue and tired, they don't want to strain themselves.
Okay.
So then they say, look, I want to skip my gym. I want to go for a run. I get tired. I can't focus. I need more rest.
Right.
So then this moves into one day or weekend. Maybe so it goes for months and then sometimes years. Like they totally went cold turkey in terms of keeping themselves physically fit. Right? But another one more thing I always tell my patients, like testosterone is like a hunter or one. So in order to be sharp, you need to have a very good level of testosterone. So that if they feel that they're unable to focus at work, or if they hold some C type of positions, they are unable to call or dictate orders, and they just like what I define like just chicha, just get go. They just let go and they just let everybody to just to run and operate, and they're the last ones who want to actually intervene, and it's let which happen as they wish. But if they take like a leadership position, or they are much more of an alpha side person, they take charge of what's happening and they execute on this, and they are able to track. Just like a hunter, you need to be fast, you need to have strength. If you are too slow, you get hunted.
True, true. And that also affects their self-confidence to some level, isn't it? And that's something that especially where
It's so like that's what
sorry, can you repeat that?
yeah. So especially their self confidence will start to drop. So that's why then it affects their sexual health, it affects the emotion. If you have less confidence when they are being a spouse
Yeah.
or also as a partner, and early start to realize, okay, the level of these hormones are getting down.
Okay. And in terms of like the erectile deficiency, yeah. And how can they get help? What should they do? What kind of testing should they go and ask for so that they can get help with that?
So this one, when it comes to ED or erectile dysfunction, we need to not just look at just the hormone. Hormones is one part of the pillar. The first one, we got to look at circulation, because somehow blood has to flow down there. And in order to be full function. So that's one big thing. Circulation is one big thing. The second is ordered by hormones. Then we need to see also, is there any neurological issues do you see if there's a nerve dysfunction due to diabetes, where you have certain nerve degenerative issue, or there is whether sometimes some form of accidents that will happen involving the spine, etc. And then the last one is the psychological perspective, which is the mental perspective.
Oh, sorry.
Looking
Sorry.
testosterone, we got to look at three other components. So the food just have to be fine. Uh, Circulation is very important. So the better the circulation, the better the performance, the better the erection quality. Hormone point, the balance between the level of testosterone, not to neglect estrogen, which is the female hormone, which is also present in the male's body.
Yes.
Sometimes the disbalance between testosterone and estrogen can also affect the quality of the erection stuff. And then the third one would be the nervous system. So for those people who have like diabetes, then nerve issues and circulation will be sometimes compromised. For those who have like certain injuries and nerve issues, we need to also seek your help. The last one is going to be the mental situation.
I think we have a lot of fatty noise coming around today.
The the mental issue will be something important. So mentally, you got to see that how is the psycho emotional position of the individual, whether it's a lot of stress, whether they have certain relationship issues. Uh, so that also has to be at that. Only then we would see in a
Bigger picture. Okay. So what are some of the testing one should look out for? That's my question. And then the second thing, are they like I'm sure there must be some hormonal or medication that can help with ED. Yeah.
so there's a lot of tests that immediately type. But usually we give it that popular test to look into the hormonal function, looking into the balance of the testosterone level, estrogen, the type, thyroid, and then we also need to look at to the general things, looking at how is the sugar level, the liver function, kidney, your 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 red blood cells, and all to see whether all of those things are checked. And other things which you will check is the inflammatory markers to see whether any form of chronic inflammation
Right.
already placed in the body. For like hormones, CRT, ESR, these are the markers that we use. So then, from looking into therapy, there are a variety of therapy that we can consider. Where if you're looking at andropause, self-focus, the focus will be looking into improving the hormonal quality. If the estrogen is too high, then we might think about certain supplementation to bring the estrogen down. Like what in females, we want to increase the estrogen, where in males, if the estrogen level is high, we need to some form of consideration of the food type that they consume, what kind of food they eat. Maybe they're having food that are very much promoting estrogen or phytoestrogens in the body. For example, could be chicken, which we all know is laced with a lot of synthetic hormones, egg to milk, got to be cautious with that. And some certain uh, hormones or these phytoestrogens or xenoestrogens can come from perfumes or certain chemicals that are being on a constant release. So xenoestrogens is one big problem. So they come from plastic and they come from a lot of products which has this kind of aromatic qualities. So they go and sit or dock into receptors in the bodies, right? It happens in males and it happens in females.
Right.
And then it trigger put a kind of estrogen. So what would be the therapy? Of course, we was considered thinking about the herbs at the start. Depends on the structure at the position of one individual. Some people maybe we have completed their families and everything, and they're okay with going to direct testosterone replacement therapy. Some we begin them with some proper workouts. Get them to do like a certain trainings. It means that with the gym workout, focusing more on like lower body workouts, deadlift, squat, to fire up their lower muscles because the wide biceps, big organs that fire up growth hormone in place of fat. Then you're looking into the food, also looking to understand what kind of foods that work well. Herbs are one thing. So like tokat ari, maca, ginseng, uh, so that are all known to like improve statistics like DHEA effects of strong in the body. So we are able to stimulate the production of these hormones in the body.
Right.
And today, besides injectables and herbs, there are also new modern delivery approaches of testosterone. There is an oral crush. You can just put it under your buccal region, and you can just fiddle wind or just play it around your oral cavity, and it absorbs. Why your situation in your oral cavity. One, and we have critics, and these products are not even available for females.
Oh, that's
So it is interesting. The deeper the testosterone in the form of the thing from the either applied on your chest or the arc or even the inner thigh, okay, it's also through the body. So they so sort of like you get like a daily dose of the hormone if you're not producing it.
wow. Okay. And what are the risk factors by taking those things, for instance?
Okay. I think that's a very, very good question that you brought up here in terms of this. Because when people hear the word hormone, steroids, they get taken aback. Or should I try it? Is it side effects now? So the good thing today is I think it's not in the perspective of going to a bodybuilding competition
Yeah.
back at testosterone with therapy, but getting it into a right therapeutic position where you feel the effect of the hormone. And so we are going into like excessive dosaging if we are capable to track it. So if patients who are under therapy, we usually ask them like how we feel, how they feel, and how they can actually achieve the effect of the dosage. So what's release a sweet spot, and then we can maintain that sweet spot. Alongside if you're doing physical activity, we cautious with the diet because sometimes we need to be careful. If you overdose testosterone and you're not tracking it, then it can even convert to become estrogen.
Ah, okay. Interesting fact.
Because because each hormones they can element X.
Okay. So when we take, let's say we take something like this, your advice would be maybe a blood check every 2-3 months just to be safe.
He said a decent journey is maybe going between 3 months to 6 months. We will sort of like guide them and follow them until they can achieve therapeutic goals. Because sometimes some patients don't understand that playing with hormones is doing a lot of fine tuning.
Yes.
For one, maybe the hormone a little bit, a few times is like wow, strong enough. But for another individual, they need to hit higher dose to achieve that effect.
Exactly. And then Right. And your clinic will offer that service by
Yeah,
checking the hormone.
we do make those kind of procedures as a doctor who focuses a general practitioner with key interest into hormones and nutrition. So I spend a lot of time with hormones in my from male hormones to female hormones, and also looking into other things like thyroid balancing. Vitamin D is a hormone.
Yes, yes.
Uh, Looking into the estrogen, progesterone, the cortisol level, the stress hormone. How does it impact to the yes, essence you prop it up. Another funny thing is some men who actually go through a lot of stress, whether it's work, whether it's financial positions, or they're having a crisis in the relationship, the cortisol level goes up. The moment the cortisol level goes up into uncharted territories, the demand for other hormones will drop because cortisol will start to dictate everything in the body because you're going to a fight and flight response.
Yeah.
Hence, all the other sex hormones will start to drop. If it's female, it starts releasing the estrogen starting to drop. If it's male, it starts rising testosterone starts. So sometimes when they are in a position of resolution, they feel that they are all down. That the way to pick them up is okay. You know what? We got to throw the kind of like a life jacket. Probably give the testosterone in and tell the cortisol like, you know what? We're taking over back.
Mm, is
So you can't deal with if you want to take everything, we are going to provide you the counter challenge.
right. Wow. Wow. Okay, that's really informative. So, one of the challenge obviously is building that intimacy as a woman going through menopause, and maybe the man's challenges probably about the same time. I'm sure in your daily work, you must see or hear a lot of growls or complaints about all this, right? So, what would you, yeah, advise a couple who may be going through both menopause and andropause?
Okay, so there we something common to sort of like a more senior couple really since and I think in my practice what I focus is not just looking at the numbers because you see if you start compartmentalizing people in the numbers and we just want to treat the number. But what we supposed to I what I like to look at is I start looking into the clusters of the perspective because like it's like much more of it's very important for me to have a proper check with them to see where they are psychologically, emotionally, because there's a lot of cases of psychological approach towards endocrinology. That means you need to understand the emotional journey, what's going on, how they are, how are they do they have some form of frustration with one's having andropause, one's throwing
Yeah.
menopause, one showing face to each other. So sort of we need to get them actualize the journey of the relationship. We then when say like, okay, why you frustrated with this? You see, your wife will say this, and your husband will react like this. So to understand, like, oh, okay, he's giving me the signs, but I've never trained to be 50 years old or 60 years old. That's it's a journey. But when you cross that bridge now, there's no cost or there's no cost for andropause. That there's no cost for like menopause. That, okay, what you gonna expect when you turn 60?
Yeah.
Right? When it is saying that you know what I want some action, or on the vice versa. The wife is having hormonal therapy and the husband is just like, I will just continue watching football and I just pretend nothing happened.
Nothing happened. Yes.
So this is where the discussion with the patient to understand actually. So if he doesn't end up like a 5 or 10 minutes consult because we gotta to go in to their like almost like go into their emotion and go into what is going on.
Yeah, I mean, that is so, so important. I'm so glad. I mean, I wish I found you when I was going through that because I'm not saying, I think doctors have to look at the emotional aspect of it. They forget and it's just, oh, they look at the medical signs and then they say, okay, you qualify as menopause, this is it, and that's it. But there's so many other levels into all this, and I Okay, so I want you to shout out to everyone, where's your clinic? Because I'm sure there are a lot of people who wants to know where's your clinic, and I get asked all the time how to get hold of someone who knows how to deal with this.
Understand. So I practice at the KL Sky Clinic. That's my practice. It's situated at Jadalang Terak called very close by to the Twin Towers. And for those people who are in Malaysia or out of Malaysia or out of the capital city, and they want to get into touch with us, there is no issue. I do provide like online consults, and we are sort of like activated about 80 labs across the whole country.
Okay.
If you think to go and get certain specific tests done at their state, we just have to order the test, and they just go in. They just show we will issue out a lab form
Wow.
ready for the clinic, and they go there. They get the test done. Within a couple of days, the result is back to us, and then we will schedule an appointment. And then we will discuss with them. Okay, what's the finding? What we need to do if they need certain therapies which doesn't need them to come down to care. We just send the creams or the trash everything out to them. If we said, okay, what we really need to see or a face-to-face discussion, then you should choose to come in, or we need to probably refer you to someone close who probably can do something similar to what we can actually.
Wow. Okay, so we have to do it for my community soon and get them all signed up. But this is before we wind up, the one of the things that as you know, my job is a lot about information, but also I am more plant based in terms of handling our hormone. Would you have anything that you think would what kind of you mentioned ginseng and maca and tonka ali, so are they the only ones, or do you have something else that you think would work for men with ED and handling their hormones?
Okay, so there's if we're looking at herbs, there are many herbs that even we use to sort of like help patients improve these hormonal levels in the body. So like I mentioned, like Tokari is a big one, very well studied with lots of clinical research. Ashwagandha is one also, but I would be a bit uh, cautious on how we play with ashwagandha, because ashwagandha, if you over consume, we can also cause you to be a bit depressed.
Oh, okay.
Right? You get too chill. Yes. Okay. So then we have like maca root. The one is improve even like seminar fluid production, sperm productions. Then we have other things like local herbs like ubi janda. That's one herb also being studied there to improve the hormonal function.
Right.
With honey goat meat, we have ginseng root, Korean ginseng, which are known which it has to improve the
Vitality.
vitality for men.
Yeah, correct.
And of course I think as we go by, I mean there's maybe other herbs maybe we do not know. Maybe in the Amazon, or maybe in Ayurvedic or Chinese medicine, it is also used. For example, like, I think they also use like cordyceps is to improve the energy output production. So it's a dance, and when you look into hormones, it's not like something that you're going to use like for a long time. Maybe sometimes it take a short period trigger, and then you take on by your exercise, your mood, and your
Exactly. That's what we say, because like you mentioned, it's not like one supplement or medication can help you for the rest of your life. Because our body is constantly changing, constantly evolving. So there's the need to navigate around it. So that would be my last question. And what would you like to say to the audience in terms of both to the men and the women handling all this hormonal imbalance that they may be going through?
okay. So uh what I will always say is like, don't hold back. I think most people just want to affiliate hormonal conditions to just sort of like their sexual perspective of itself. But this is beyond the sexual facade. It represents how we look. For example, like females having good level of estrogen technically means having good level of skin, having key to hold more collagen, having ability to have better bones, reduction of osteoporosis,
Yeah.
in better heart conditions, having more clarity, having no vaginal dryness, having better quality intimacy with your partner. So can you imagine that how many wins you will add that? And the same thing goes to like men, like your confidence, your energy, your rapport with your spouse, improving the confidence in a control with your focus at job. You're much more of a go-getter rather than you being too silent with everything and just like not standing up for anything just because that you feel that the world has collapsed on you. So uh getting a proper blood test and getting advice from doctors who know how to manage this is going to be good. So when you're doing a blood proper screening, you now need to invest a big more to get this kind of test that alongside. Equate to a lot of people like most of the people are always going to do a general medical screening, but it's just looking at the water wastage like alam flora and in the waters. Okay, but you forgot to look at the TMP generators about the kids see what spot on, like kids can spotlight on that you are in your full gear.
Yeah.
So hormones from the thyroid, from cortisol level, from estrogen, the testosterone, your vitamin D, and your inflammatory markers gives you the ace position. How to get you into the A game. Don't live just like you had a straight pass, you just got D and then you just want to survive for right?
Yeah, exactly.
Is your like and doing that you are able to see and perform better. Because when you are healthy, you're in a better state of health. That means that you can think better,
Exactly.
better opportunities come. You're able to take better business roles, better responsibility in leadership, better position because you can deliver. You have that power to deliver, and then you do not collapse and say like, I cannot go. I'm tired. I will not take this meeting. I cannot do this. I cannot go here. I cannot. So that you succumb to a choice of being weak. With technology today, there's no reason not to swat solution
Exactly.
over the ISIS.
Yeah. Wonderful, wonderful. Your what you just said is so true. Don't live your life half-heartedly. Do it fully, playfully, and be present. Thank you so much for being present with us at Midlife Mojo 25. And I hope that our ladies and all the followers will like and subscribe. And until next week, bye. Thank you.